For how long do I have to take Accutane? What's the duration of Accutane treatment? That's the question that we're going to answer today. I'm Dr. Arthur Kolsky. I'm the founder and medical director of Advanced Acne Institute, and we are a unique dermatology practice. We only treat acne. So we like to make these videos to share insights with acne sufferers who are navigating the path toward clear skin. In today's video, we're going to talk about the duration of Accutane treatment. Now, this is not a straightforward answer, and let's explain why. So if you look at the data, the study data that was used when Accutane was first approved a long time ago in 1982, the patients were given this medicine for 20 weeks, and some people continue to use that guideline in practice today. And as a matter of fact, some insurance companies use that as a guideline to see what they're going to cover as far as insurance coverage of Accutane treatment. The reality is a little bit different though. So over the years, we find that there are some differences in patients and in outcomes. And so some of that information has been changing, and it continues to change to this day. So we find that patients are individuals, as we know in medicine, that patients respond differently to different medicines. And so the same goes true for Accutane. Some patients do very well within a certain period of time. Other patients take a longer time until they start to see the best results. And when we look at the studies, we also see differences in outcomes. So some studies show that using Accutane in a very low dose way for a longer period of time might have certain benefits, such as certain side effects might be less, and the patients might tolerate the treatment a little bit more because some of the things like dryness, which is a common side effect of Accutane, is much less, and there are other things as well. Other studies use a higher dose and maybe a shorter duration. And in those studies, the doctors feel that using a higher dose for a shorter duration might be better because it might give us a stronger treatment. And those doctors who advocate for a higher dose regimen feel that there's a benefit to that because it can lead to potentially a better outcome, meaning a less chance of acne coming back after the treatment is over, and a more effective result. So in practice, the reality is that we're constantly making decisions on a patient-by-patient basis as far as what dose to give and what duration of treatment we should use. And there's something called a cumulative dose. The cumulative dose is a measurement of the total amount of Accutane that particular patient took when we decide to stop the treatment. And we find that we want to achieve a certain cumulative dose to help us have the best opportunity of preventing acne from reoccurring once we stop. So whether we use a low dose or a higher dose, we still look at the cumulative dose to try and make sure that we target a high enough cumulative dose so that the patient has the best chance of not having a relapse once the treatment is over. Another thing that we look at is how well the patient did. If the patient responded very well and achieved completely clear skin, that's what we look for. So we don't really want to stop the treatment while the patient is still having active breakouts. So once we achieve at least a month or two of completely clear skin, then we feel better about stopping the treatment. So that goes for whether it's a low dose treatment or a medium dose treatment or a higher dose treatment. We want to try to continue the treatment until the patient has achieved completely clear skin and has remained clear for at least 1 or 2 months. So all of these things come together to help us decide on how long a person's treatment should be. And when we're talking about practical matters, a lot of other things come into play. For example, some patients forget to take their pills on time. So at the end of each month of treatment, they might have a certain number of pills left over because they didn't take all those pills. So that can prolong the treatment. Some patients might get sick during the treatment, and they might need to stop the treatment until they get better. For example, they might get the flu, or they might get some other illness unrelated to Accutane treatment. So we might need to hold off on Accutane until they get better, and then we can resume our treatment. So that might delay us. Some patients might experience a flare of their acne in the beginning, and we talk about that in a different video. Some people refer to this as the purge, which is not a really accurate name or way to describe that, but it's a flare-up of acne that might occur in the very beginning of treatment in a small percentage of patients. So when that happens, sometimes we have to take a break from Accutane until we get that under control, and then we start back again. And so that might delay us. Other things might come up, other potential side effects. Maybe there's something that we find in the blood work that we need to take a little break and change the regimen. Maybe we don't give them the medicine every single day of the week. Maybe we only give it Monday through Friday or Monday through Thursday. So there are a lot of different variations of the treatment that we could use, and those things can prolong our treatment. So these are all things that we take into account. Now, what we tell our patients is that the average duration of treatment is approximately 6 to 8 months. And that's the average. So most patients who begin a course of treatment with Accutane typically use it for about 6 to 8 months. But as I just mentioned, there are a lot of reasons that duration might change. In some patients, it might be shorter. Maybe they do extremely well and they clear up very quickly, and maybe they don't want to continue, or maybe they don't need to continue because their response has been so great and they've reached a good cumulative dose already by then because of the dose they're on. So maybe we can stop the medicine shorter than the 6 to 8 months. And then other patients might need to take a little bit longer. Some patients are resistant to treatment. So we find sometimes it takes a much higher dose of Accutane for some patients in order to get the results that we're looking for. And that's another thing. The dose is not a standard dose. There's a recommended dose. So usually patients achieve a certain starting dose for the first month, and then they go to a secondary dose for the rest of the treatment. And we have a typical dose that we shoot for, but sometimes we need to use a higher dose than that. And so all of these things can come into play when we are trying to tailor a particular course of treatment for a given patient. So all of these things matter. So the bottom line is medicine is not a cookbook procedure. It's an art. It's not just a science, but it's also an art. And we have to modify our expectations and modify our treatments to fit each patient's circumstances. So it's important that we look at the medical history, we look at the patient's circumstances. If the patient's going to need to go on a vacation and be in the sun, we might want to stop the medicine temporarily and then resume it subsequently. All of these things are taken into account. So practically speaking, the duration of treatment can vary depending on the patient. The average is approximately 6 to 8 months. So at least you have some idea of the duration of Accutane treatment for the most part. But keeping in mind that duration can change either way depending on the circumstances that occur.